Hello, and welcome to Health Talk, a show where we dive into common health challenges with local experts to bring you the information that you need to live your best, healthiest life. My name is Dr. Desmar Walks, family physician and local health authority for Austin-Travis County. First of all, thank you for being on our show today, Kevin.
Absolutely.
What we like to do is start with asking our guests, what is your why? What has brought you to this work?
Well, my why is really simple. It's helping people. I grew up in an immigrant family where they wanted me to be doctor, lawyer, whatever else like that. And, luckily for them, I was always interested in the healthcare field. But, unluckily for them, I fell in love with public health and community health and, the mission behind that and what it really entails. So, as I was going through my education and starting my work, with various nonprofit organizations like Austin Public Health, the CDC Foundation, and Casa Marianela. And I am now at Foundation Communities, helping people sign up for accessible and affordable health coverage. And it's really, really fulfilling, being able to work hands-on and face-to-face with people and, just help them get that help, helping get access to help. That's a lot of help, but but it's just really fulfilling to be able to be a positive impact on people's lives.
And amen. Thank you for doing that, because as we know, that's the first step in getting help, right? You've got to be able to get in the door. And so having that coverage helps everybody. And thank you for the work that you do. So can you speak a little bit about some of the barriers that you see that people encounter when they come to you looking for health coverage?
For sure. I think there are probably two big barriers that I can think of. The first would just be education. Being aware of what marketplace it is, what options are out there for you, and kind of the details of how it all works. And the second, I would say, definitely affordability and financial concerns. Healthcare is something that is always seen, and rightly so, as expensive and maybe a little bit inaccessible. But knowing what's out there and knowing that with Marketplace, there are financial assistance options, you could potentially even pay $10 or less a month for an insurance plan.
That's really exciting news, and one that I'm sure many in our audience would like to hear more about. So we're going to kind of delve into that some more and talk about open enrollment and Marketplace, which Marketplace is also known as the Affordable Care Act. Is that correct?
That's right. Yeah. So the Affordable Care Act was signed, and the Marketplace as we know it, or Obamacare, came to be. So with Marketplace, it is essentially a service that is federally regulated that lets people shop for health insurance through their website, healthcare.gov. And the benefits of healthcare.gov or Marketplace are that they provide financial assistance depending on your application, your situation, to help you pay that monthly cost of insurance. It's tailored specifically to you based on your needs, based on your household size, and you cannot be denied based off of any pre-existing conditions. So if you have, something that you're worried about, something that you've had issues with previous insurances, Marketplace has your back.
So when does open enrollment start, and when does open enrollment end?
Open enrollment starts November 1st, so we're currently in the thick of it, and it ends on January 15th. But I do want to let you know that if you want your insurance to start on January 1st for 2025, then you need to enroll before December 15th. And if you do miss that deadline, there's no problem. It's still open enrollment, but if you enroll between December 16th and January 15th, then your insurance will start February 1st.
Thank you for that clarification. What do people need to do if they miss open enrollment? Do they have another opportunity?
Yeah, so, open enrollment just lets people sign on regardless of their income level, household size, things like that. But if you, for some reason, missed open enrollment, or maybe you didn't even need Marketplace at that point in time, there's no problem, because there are things called a special enrollment period. So you get a special enrollment period, basically an exception, if you have any major life changes. So let's say you're very low income, you lost your job and your insurance, had a baby, got married or divorced, recently released from incarceration, really anything that impacts your life in a big way, we can help you check to see if you qualify for a special enrollment and see if we can get you health coverage.
So is Marketplace available to people that are Medicare recipients?
So no, actually, if you have Medicare, then you were no longer eligible for Marketplace. But what we normally do is refer people to the Area Agency on Aging. They are a great resource. They have people who know so much about Medicare, and they've been a great help to the community.
So what about if you have an insurance that's offered by your employer? Are those individuals eligible for Marketplace?
So yes, they are. However, there is a bit of a caveat. So if you have insurance through your job or an offer of insurance through your job, then you can sign up for Marketplace insurance, but you would not be eligible for the financial assistance you would receive to help lower the cost of that monthly payment. But if you think that your job insurance is too expensive or they're not covering everything that you need, prescriptions or certain visits, then come and talk to us. Give us a call because we can absolutely help you figure out if you could still be eligible for financial assistance based on that. According to the federal government, a plan that is offered to you has to be considered affordable and adequate for it to be considered health insurance. And if your office and your job is not both of those, you might be eligible for financial assistance.
And you said when you were talking just now that covering certain types of visits. So does Marketplace cover things like treatment for mental health and rehabilitation?
Yes, actually, Marketplace does cover rehabilitation, mental health. A lot of people that I help are currently undergoing cancer treatments or, things like that. So it really is all encompassing for the most part. Obviously, there are different plans with different doctors, and what we do at the Prosper Center with the health coverage team is help you find the perfect fit for you.
Can you describe how you're supporting residents that live outside the Travis County boundaries?
Yeah, absolutely. So right now we have our regional outreach team that goes around to different counties within Central Texas and works together with the community resource centers to provide in-person enrollment assistance. Now, there are many reasons that maybe people wouldn't be able to go to an in-person appointment, whether it be transportation, accessibility issues, or maybe they just don't have the time. In these cases, we do offer virtual or phone appointments to anybody who needs it. So not only are we helping people within Travis County and the surrounding areas, but we're also able to help pretty much anybody in Texas that gives us a call.
And how do they get in touch with you?
Yeah, so our number for our health coverage program is 512-381-4520. That's 512-381-4520. If nobody's answering at that point in time, leave a message, give us your name and kind of what you're looking for, and we will make sure to get back to you.
We know that although the ACA was put in place over a decade ago, there are still millions of Texans without health insurance. And before we get started, we were talking a little bit about that. And I know that it's based on the federal poverty limit. And for 2024, for one person, it's someone that's making $50,000 or less a year. And for a family of four, it's someone that family receiving an income of less than $30,000 a year and one. And again, that's for 2024.
Mm-hmm.
So can you speak a little bit about the things that someone needs to bring with them or have available for you so that you can help them?
Understandably, there has been a lot of hesitancy when it comes to dealing with healthcare and health coverage within disenfranchised communities. Now, our way of attempting to break through these barriers is by educating people. I think the more that people know about these complicated things and these overwhelming issues and topics, the more they're able to help themselves and protect themselves and their family. Health insurance is something that can seem predatory. It can seem overwhelming, but the truth is, the more tools you have at your disposal, the better you can navigate that. The way that we really believe is the best way to break down these barriers is by empowering the people and empowering our community to be able to better understand these topics and, help themselves and help us. So
does Marketplace pay for colonoscopies and mammograms and cancer treatment?
That's a good question. And Marketplace Insurance is a list of insurances that are provided by private companies that have to meet certain regulations. Within a lot of communities, especially low-income communities, people tend to wait until an issue is overwhelming and they can't ignore it anymore to go to the clinic or go to the hospital. Unfortunately, in a lot of cases, it's either too late or it's really, really expensive in order to treat those issues. Medical debt is one of the biggest reasons for bankruptcy and one of the biggest causes of debt in this country. And that can be really overwhelming. But with Marketplace Insurance, they offer free preventative care that is amazing for being able to afford to go to the doctor, not have to worry about, how you're going to pay for it or how many payments that you're going to have to make. Depending on your application, your area, and your zip code, Marketplace provides you with a list of insurance companies in your area that will cover clinics and doctors that are near you. Now, your original question was?
Do they cover colonoscopies, mammograms?
That really depends on the insurance company and how they end up billing things at the clinics. But for the most part, as long as it is preventative care, it will be covered and it will be free.
Oh, that's really important for our listeners to know, because as we know, a lot of people are behind on some of those preventative screening and exams that they need to have had done. So after this process has been completed and someone's enrolled and they have healthcare coverage, how should we all be making the most out of our health coverage?
Number one, and I always tell people this, go to your doctor. Thankfully, with Marketplace Insurance, preventative care is free. So you can go get your checkups, you can go get your blood work, and make sure that you're healthy. A lot of the time, within my community, within Black and Brown communities, and any disenfranchised community really, people tend to put off any sort of health issues until it's too bad to ignore. Curing something or treating something is always far more expensive than preventing it. So please go to your doctor. It's always going to be a great idea. And secondarily, I would say reach out and ask questions. Talk to your doctor, your clinic, or other organizations like Foundation Communities, because what I've seen is that if someone's willing to reach out, there is an abundance of people in our community that are willing to reach back out to you and help you with whatever it is you may need. There are a lot of problems and a lot of difficulties and obstacles when it comes to health coverage. Understandably, there's a lot of hesitancy when it comes to delving into that world. Historically, it's been inaccessible, expensive, and overwhelming. But places like Foundation Communities are willing to, lend a helping hand in guiding you and helping you take those first steps into advocacy and into empowerment, not only for yourself, but for your family and by extension, your community. So by all the time, I always tell people, reach out at any point, give us a call, make an appointment online, because we're always willing to help.
So what I hear you saying is you're there even after the coverage is obtained to help them navigate that system.
Oh, absolutely. So we are open year-round, not only during open enrollment. People get health insurance, but then sometimes they have questions. They run into issues or they need something different. We're there all year round to answer people's questions and do our best in providing that guidance.
Thank you. And I just want to piggyback on what you just said. We see people at health fairs and they see community health workers out in the field, and they may have a blood pressure screening or a blood sugar screening and be told you need to get something done about that. And reaching out to you at Foundation Communities and getting the coverage and them being able to make that appointment to get that help is really going to be key to being able to prevent something bad, like a heart attack or a stroke. So
for the marketplace, in terms of income, whenever you're applying, really what you're doing is you're providing an estimation of what you're going to make for the following year. For example, for this open enrollment that goes from November 1st, 2024 to January 15th, 2025, what you're doing is you're estimating your total yearly income for your household in 2025. Now, of course, nobody knows the future. People get raises, people lose jobs, anything can happen really. So what they ask for you to do is just to give your best estimation, and thankfully, you're allowed to go back in and change that estimation whenever you need to. They're very flexible in that sense. So you wouldn't need much more than knowing your social, and I'd say knowing any information about any employer coverage you may have.
Okay.
Yeah, so what I always tell people whenever they come into the office and have an appointment is that we are a nonprofit. So we do not get any sort of commission, and we have no financial interest in giving you any sort of plan. Our goal is simply to help you get the best possible health coverage and help you get the best plan that fits for you.
As far as Texas goes, because we don't have expansion Medicaid, this is an option for people that are at whatever your eligibility level is. Is that correct?
Yeah, so, I mean, obviously it is a estimation. If you believe that next year maybe you're going to make a little bit more or maybe a little bit less than you have this year, if you believe you can start, a side business or something and your income is going to go up, we can absolutely help you look at plans based on that. If you have a set income, we often refer people to the MAP program here in Travis County, and that is something that has helped a lot of people.
And so what's the eligibility for the MAP program?
Yeah, so the MAP program helps people in Travis County who I believe are between 0 and I think 150 federal poverty limit level. They have different levels based on your income. They primarily serve people who don't have access to other health insurance or need assistance while they're waiting for an answer, whether it be for their immigration status or other health insurances like Medicaid or CHIP. Let's see. Sorry, taking a pause. Central Health is the organization here in Austin, or in Travis County, that heads MAP, and they've been an amazing resource for people. I've seen people that have been referred to us that have wonderful things to say about MAP, that it's helped them get through really difficult health issues that they've had. And we also refer people to MAP whenever they're not eligible for Marketplace.
For those of you that are listening who do not have health care coverage, please reach out to Foundation Communities. ProsperHealthCoverage.org is their email or website, and you can also call 512-381-4520. And remember, open enrollment is open through January 15th. And you said that getting that coverage before January 5th, just December 15th allows you to have coverage by January 1. Is that correct?
That's right.
Great. Thank you, Kevin, for coming on the show today. You've given us a lot of really good information that's going to be helpful to people in our community. That's all the time we have for today's episode of Health Talk. Thank you to KAZI 88.7 and to St. David's Foundation for their support of this program. Until next time, take care of yourselves and each other. This is Dr. Desmore Walks signing off. Be well.